In a story we first brought you last night, CityNews found that many walk-in clinics were either closed or had reduced hours over the holiday season, and this may have been adding to a surge in patients. Well, today we were invited inside SickKids Hospital. The emergency department here has also been treating an unprecedented number of children over the last few weeks.
Over the 2 weeks of the holidays, it was a 45% increase over our annual average. So that's a huge number of children for us to kind of deal with.
The emergency department here at SickKids Hospital maps out every year, right down to the hour, predicting when a surge will hit so that they can adequately staff and be ready for any scenario. Here's the breakdown. Over the summer months, they plan to see 170 patients a day. When winter hits, they predict to see 260. But this December, that number ballooned to 320. That's 60 more children per day than the ER was prepared for.
A few years ago, we started a surge clinic. Last year, our surge clinic, which sees the lowest acuity arrivals, saw 700 children. This December, they saw 2,000. So despite our best efforts, we were still overwhelmed.
So what's behind this surge then?
The first is December is a time when we see viruses. We see the beginning of flu season. But we also know when we talk to our patients, it comes down to kind of three things. First is access. So families have trouble accessing care during the holidays with primary care clinics being closed. They also have trouble navigating the system during the holidays because with those closures, patients often can't find the right follow-up and they don't know where to go next, so they end up coming to the ED. And the third piece is really communication. During the holidays, patients have trouble communicating with their physicians, and again, they end up coming to the emergency department.
Dr. Jason Fisher, the head of emergency medicine, tells me during the peak period, backup doctors, which are rarely used, were called in 80% of the time. He'd like to see some changes to how walk-in clinics operate.
I would love to see resourcing for those institutions and sites that are open during the holidays, really to help resource appropriately for these surges.
SickKids has also seen a steady spike in the number of patients year over year because of a growing population. This year, they added 10 unfunded hospital beds just to keep up with demand. What is it like knowing that sometimes children are waiting to receive medical care?
Yeah, like I said, no one is more frustrated when a child waits than the providers that are in the emergency department. We recognize the challenge, we recognize the frustration, but we're working as hard as we can to make sure that timely care is delivered.
According to the Ontario Medical Association, a winter surge hits just about every year, usually during flu season. It can add 30 to 50% more visits to emergency rooms. Coming up a little later on in the show, how you and your family can help keep those numbers down. This week, CityNews has been reporting on a major surge in visits to the ER and the lack of access to family doctors and walk-in clinics over the holiday season. The emergency department here at SickKids Hospital, for example, has treated an unprecedented number of children over the last few weeks. Today, I got some advice from the head of emergency medicine here on how you and your family can help keep those numbers down.
In anticipation for the holidays, really ensure that their doctor's office is closed and not accessible. So often there are backup systems within some of these clinics that patients just aren't aware of. And so I think accessing those first is the best, and talking to their doctors before the holidays start about what to do is key. The second is About Kids Health, which is our website, aboutkidshealth.com, has a lot of good information that can help patients before they need to seek care. It can give them some extra kind of medical literature about when they need to come to the emergency department. There is an opportunity to learn more about fever and to read about that, so parents know when it's appropriate, when their child has a fever, to seek care, and when it's okay to wait for a couple of days and see their primary care physician. The same with some simple things like vomiting and diarrhea. Often, within the first few hours of those illnesses, it's okay not to rush out. But again, I would really encourage parents to really educate themselves, take advantage of resources like About Kids Health to learn about what to do in those circumstances.
The emergency department at SickKids Hospital saw a 45% increase in patients over the month of December. Humber River Hospital told City News they've had the highest volume of patients on record this holiday season, and several numbers from the Ministry of Health and Long-Term Care show a number of GTA hospitals are also operating over capacity, including North York General, Trillium Health Partners, and the Scarborough Health Network. Now, according to the Ontario Medical Association, a winter surge happens every year and can add 30 to 50% more visits to ERs. Now, if you've recently had a long stay at a Toronto ER, we would like to hear from you. You can reach out to us on citynews.ca, and that's also where you'll find a link, that Dr. Fisher mentioned about Kids Health.